All right, guys. Next up, we're going to have Amber Ray talking to us about the Body Ready Pro and how that's helping patients to prepare for birth. Amber, are you on the call? I
I
know she's,
am. I'm here.
oh, good. Oh, good. And Tavangi's going to bring your slides up.
Okay, perfect.
Okay. All right. Guys, this is Amber Ray. She is located in Jonesboro, Arkansas. She's an advanced practice RN there and works in one of the, I think, believe one of the clinics in the clinic setting. And so she's going to talk to us about her training and how she kind of found herself. I know she's a Lamaze instructor as well. Kind of an overview on the Body Ready Pro. So Amber, we'll let you take it away, and we thank you for being here today.
Thank you. Thanks for having me. And thank you for the introduction. I'm actually, because we know I can be a little long-winded. So I'm going to skip past introducing myself, but I do come with 6 to 7 years of labor and delivery experience. And like she said, I am a Lamaze certified childbirth educator. And I recently this year finished my Body Ready Method Pro certification as well. And so basically, I mean, this fits. I'm so grateful for Spinning Babies before me as well, just because Spinning Babies was actually my first time getting involved with and learning about physiologic birth. And so it just kind of started this desire for gaining knowledge more about what's going on in our body. So my presentation is going to be similar but kind of different from what Miss Tammy was talking about. But the main thing is just wanting to get across that a balanced body, like she stated, is a vaginal delivery prepared body. And so we can go to the next slide here, because we're going to be talking about what alignment is. And so this is a big deal as far as when it comes to Body Ready method, just talking about alignment and exactly what that is. And so body alignment is the way in which the body maintains a balanced posture. This is important because when our body is in alignment, we are not experiencing as much strain on different muscles, injuries, and pain is prevented. And then we're able to just utilize and optimize our body movement in the best way. And the way that I like to think about this, we're not just bones. We are bones that have muscles and ligaments attaching to those. We're holding in organs. We're covered by skin. So there's a lot of things. The bone is the structure, but depending on what's going on with our muscle will determine how our alignment is. And so there are some good indicators for alignment that I've written down there. Just our head, we want our head over our shoulders, not forward or backward. She had some great pictures showing that of the guy that was leaning forward with his neck out. Our phones will do that to us. So that's actually an unaligned body position. Our shoulders should be level, not rounded or backwards. We want our spine to maintain the normal curve, which we know is kind of S-shaped, but it shouldn't be exaggerated in any type of way. Our hips, we want them to be leveled in the center, basically over our heels, not leaning forward or backwards. And we want our feet to be aligned with our hips, and just avoiding, the duck walk position, the inward position. We want them to be aligned and straightforward. And so if everyone can bring up their chat box just for a little bit of engagement, so that way we can respond to my next slide here. So true or false, due to the demand of the baby on the body, a pregnant woman cannot maintain proper alignment. Is that true or false? Awesome, awesome. Oh my goodness, we are so smart. Perfect. False, false, false. Okay, that is absolutely right. Everyone is correct. If we can go to the next slide there. The answer is false. So we're perfect. Just because the load out front increases does not mean the lower back has to curve out or the hips need to lean forward or anything just to be able to walk. The truth is that the pregnancy stance, or the idea of what we have for a pregnant person, when we think of pregnancy, we think of this certain type of look, and actually what we're seeing is a improperly aligned body. That means that some of the muscles that are necessary for stabilization, they're weakened in some sort of way. And so whenever we have that appropriate strength to all the muscles, we're able to be more in alignment. So we don't have to necessarily look pregnant just because we are pregnant. We can go to the next slide. So the 3 Ps of labor, this is actually a Lamaze principle, and I absolutely love it just because it really shows that in order to obtain a vaginal delivery, this is a multi-dimensional approach. And so we have the passenger, the power, and the passageway. And the passenger refers to the baby. And we know that babies twist and tort and do all kinds of things in the womb. But one thing we really don't think about is the fact that your baby is going to settle in the way in which it is able to. So depending on what's going on in our body, that is how our baby is going to go. They are phenomenal at finding their space, and they're going to find it and they're going to relax in that space, and it's just basically based on where they have give. And so that can either put them in a position that is helpful for a vaginal delivery, or it can be something that's hindering. And so we just need to address the baby as well, which spinning babies is awesome with spinning that baby to get in the right position. The power refers to the strength of the contractions. And so, of course, we know about that, whether contractions are strong enough. And like Miss Tammy said earlier, our ideas have always been about power dilation or contraction strong enough to create dilation. And so now we're learning that there is different things going on in this body that we need to take into consideration. And that includes, like I stated before, the passenger and the passageway. And so that is, the passageway is the focus of this presentation, and that refers to the pelvis and the pelvis floor. A lot of times as nurses, what we feel is that we can only crank the pit. Like, that's our idea, is crank the pit, put the pit up, get that power as strong as we absolutely can. But with this information that has always been there, just physiologic, what's going on in our body, we are given greater capability to manipulate in a good way the baby, the body, and given the right tools and the right frame of mind, we can become actual body detectives. So that way we can facilitate and encourage vaginal deliveries by manipulating all of these dimensions in these labor rooms. Going over to the pelvis. So for one, which I guess I'll have to scoot back a little bit. Let's think about the pelvis kind of differently. For one, it's not just bone. The pelvis is not just stagnant. It's just not sitting there. It's actually a mobile structure, which of course this is very much exaggerated, but there are joints here in between the pelvis, and those joints are there for a purpose. Now, of course, I would not expect for somebody to just be able to do this. That's way too much, but even a centimeter can do a lot for this pelvis. It can do a lot for the room that we have within our body for a baby to navigate. A big deal for us is our sacrum here that is able to, I don't know if we can see that really good, come in and out, creating more space depending on where you are. So if we're more hanging at the top of the pelvis and that baby's not going down, maybe it's a sacral issue. And so maybe it needs to come in some, but of course that's not helpful whenever we're trying to come out the outlet, because now we're running out of space. But we need to have mobility within all of these areas. And so that is just something to consider, and just knowing that's why we say a Lamaze principle is to move around, walk around during labor. We want to be able to move this pelvis in any type of way that we can that will facilitate moving the baby to move down into the pelvis. We also must realize that there are muscles attached to the pelvis as well. The muscle on the photo here at that bottom photo down, the one that's closer to the spine, that is called our psoas muscle, and it actually goes from the inside there around that spine, but all the way up to our ribs. That is a muscle that is very particular when it comes down to our emotional response to things. And so one of the things I like to think of, like, let's calm down the psoas, because if you're anxious, then that psoas muscle is going to be rigid and tight. And what it does is it affects the mobility of our pelvis. So that's why it's so important, which I do think we have someone that does hypnobirthing speaking to you as well, but it's so important to have a labor room that's calm and relaxing and not causing anxiety and things, because we want that psoas to be relaxed. We need their body to move, so we need to relax this body. We can go to the next slide. So another dimension that we need to think about when it comes to our body is just our pelvic floor muscles. We know that the pelvis is not just sitting there and it's just gaped open. We know that there are muscles down here, and we know that those have to be relaxed for a baby to come through as well. And so, of course, the pelvic floor is there is extra important as it yields, like as in relaxing, in order for a baby to exit the birthing body vaginally. Now, it also has a function when we're not pregnant of just keeping everything in. Of course, you have a whole baby that's sitting in our pelvis, and so we don't want to just release our pelvic floor and cause all kinds of bladder issues and things like that. So it does have to have some sort of firmness about it. For holding on to that baby's weight. But during labor, we do want it to relax, because at that point we're wanting it to deliver. And so we need to address those pelvic floor muscles as well. And the next one. So one thing that we haven't, which this was new, Body Ready Method brought this to me, the next two slides actually, and it has literally changed my life and idea, and it really brings in that perspective of what a physiologic birth is. And this is about the fascia. So the fascia is just, think of like a raw piece of chicken breast or something, and you see that real thin membrane that's on the outside that you can kind of separate. That's what the fascia is. It's a connective tissue. It surrounds the muscles, the bones, the organs. It basically encases everything. In the way that it encases and covers our entire body, it makes it harmonious. And so it's through our fascia that our muscles actually communicate with each other, stating that like your shoulder up here can have direct communication to your right thigh just through the fascia, because that's how it works and facilitates. And so if we think about like if we stretch our arm out, stretching our arm doesn't just occur because we're moving our bone, but it's occurring because at some point this was tightened here and now I'm stretching it out. So this has to lengthen and everything else has to change down my body to be able to even perform that movement. And so what the fascia does, it provides support and separation for muscle and organs, and it also helps to transmit the force generated by muscles and assist in the movement of limbs and joints, as I just showed. So this next one, sorry. And so this brings up the concept of tensegrity. And so tensegrity is basically how all of this functions together. This is how we maintain stability with dynamic movement. It's just basically showing like our entire body is connected, and depending on where we have tightened and we have lengthened muscles, our body is going to adapt, because our whole body's purpose is for us to maintain balance. In whatever way that it can, it is going to maintain balance. Stability, when I say balance, so I'm sorry, it's going to maintain stability. And so whatever it has to do, it's going to do whatever it needs to do to be stable. So that may include like if I'm sort of leaning over to the side, but I need to stay in the center, my muscles are going to tighten in certain areas just for me not to fall and hit the ground, because that's how our body works. And so tensegrity provides the body with dynamic stability, meaning it can maintain its structural integrity while allowing for movement and flexibility. That's why we can lean over and just not hit the floor altogether, because your muscles are contracting based off of the fascia that has let our body know that it's trying to do something there. And so it keeps us in a more stable area, even though the balance is thrown off of it. So I hope that I'm explaining that concept well. Please let me know if I'm not, so that way if I have time at the end I can go through and try to explain it. It's a bigger concept than what I'm explaining, but it really does show up and function within our labor and deliveries as well. And so go to the next slide, please. So when we're bringing this all together, what I'm saying is, by the way of our fascia, which is our communication membrane, tensegrity helps us to move. It helps us maintain that stability. However, like I stated, it will maintain stability by any means necessary, meaning that if we don't have the neutral body strength, as in everything is at the same strength, all the muscle is at the same strength within our bodies will learn to compensate. So it will do this by some muscles working harder than other muscles, which then allows for those muscles that aren't working as hard to become weaker and weaker and weaker over time. And so with this compensation, that is meant to help us, because it is, that's how our bodies function to protect us, it actually creates a misaligned body. And so just as much as tensegrity can be harmful for our body, I mean, it's doing a good job, it's doing what it's supposed to do, but we can also see that we can see issues within our body. But just as much as we can see unbalance within a body, we're also able to restore that balance. So we can go to the next slide there. And so when we're talking about restoring balance within the body is a lifelong process. That's why Miss Tammy, when she mentioned about spinning babies, doing this throughout the pregnancy is really the best way, really before pregnancy is what Body Ready Method discusses, but doing these different stretches and we call hours tools throughout the pregnancy is the best way, because we're actually addressing the issue. We don't expect for someone that has a slump posture like this to all of a sudden just walk around like this, you know, with a better posture. We have to work on that. We have to engage those weaker muscles so that way they can come up to what the stronger muscles are doing. And then the stronger muscles can relax and we can find their neutrality with it. And so, you know, the best thing to do is to do this during pregnancy. However, that's not always the case, and we're still working on that as a state on providing those resources. But I did want to teach you all some things that we can look for and what we can do to temporarily create balance, so that way we can increase our vaginal delivery outcomes. Next slide. So this is me, excuse the picture, but I did want to show some of these tools that we learned. Now, granted, all of this, and if you want to take a picture of it, that is perfectly fine, because you can find them on Google and you can find out how to do it. And Miss Tammy is going to teach you all the sideline release, which to me is absolutely amazing. But to go through them, the sideline release, it releases the entire fascia from the pelvis on down your legs, really mid-abdomen on down your legs while we're doing that. And so that's why it works, because you're releasing and basically telling that fascia to relax, so that way the entire pelvic floor will be able to be relaxed in that way. Those muscles and ligaments will be relaxed. And so that the sideline release actually allows for full pelvic mobility whenever we're doing that. I'm a sideline release person before I really got more knowledge, and this was probably the last year of my labor and delivery experience, but got more knowledge about how to look at the full body systemically and become a body detective to know what's going on in the body. I sideline released every last patient before I started their induction. And then I would do it like 1 or 2 times throughout the delivery, just because I noticed that once you relax those muscles, this was even before Body Ready Method becoming a pro, but once we relax those muscles, these babies, they came on down like butter. And so I'm not saying do it with every patient that you have. There are definite reasons as to why to do all those, and that's beyond what I'm going to teach here. But it is a good balancing technique for our pelvis, because it really does lengthen those muscles. Another one, because sometimes we get a little nervous about the water breaking too early with sideline release. I think it only happened to me one time with a patient, and it wasn't a prolapse or anything, but that baby just slid right in position and the water did break. She wasn't dilated enough, but we don't worry about dilation. We worry about more where the baby is, because once afterwards, she progressed through labor just fine, because that baby was in the correct position, because I changed her body balance to allow for that baby to do so. And so the standing psoas release is the picture that I'm trying to show here on my actual slide. This is very helpful whenever we have an anterior tilted pelvis. And so I will show pictures of that the next slide. For people who have, they're more stressed, and we can tell this whenever a patient comes in, more stress, everything is just kind of tight in the first place. And so what you do is you get a stool or something. That's me standing on just the brick there, trying to show that one foot is on, the other one is not. Someone can be standing in front of them, just helping them with stability. And all they're doing is just letting that leg swing by gravity, not force it to swing, but they bring it all the way back and just kind of let gravity swing that leg into relaxation, back and forth. And what we're doing is we're relaxing those ligaments there. on the side that will help with mobility of the pelvis. It's basically, it does very similar to a sideline release, but it's also something that we definitely can do before we get patients into the bed for labor. We can get them to, get on that little, I forgot what they're called, but you can have them stand on something and just do that leg back and forth. Now with the sideline release and with the standing psoas release, we're talking about balance. So do make sure that we are doing both sides, because we don't want one to be lengthened and the other side to still be tight. That's not going to be helpful. So do know if we sideline release to the left, we need to do it to the right. With the standing psoas, we need to do it to the right. We need to do it to the left, both of them. The next one here that I wrote down was called the glute scoot, and it's kind of complicated to explain, so I would recommend to find a video, but it relaxes the QL muscles, which basically insert here at the top of our pelvis, and they're all the way up the back. And so whenever these are shortened, and they come here too, whenever these are shortened, they don't allow for the sacrum to move back and forth. And so we want these to be lengthened and supple so that it's not just holding so tight here and not allowing for our sacrum to move back and forth. And so we'll see this a lot with our hip hike or tilted pelvis, which is on the next slide that I'll show. That's me again, being exaggerated. And so that way, just so we can see what these different positions kind of look like. The one on the left is my posterior tilt. So I just kind of think of that like a tucked under, like someone whose bottom is just tucked under in this type of way. And so what this is basically letting us know is that our pelvic floor is way too tight. And I would recommend for you to take pictures of these so that way you can maybe type them into Google and see more different examples of it, so you can see what they look like when they walk in, because they can tell us a lot. Just from our patient walking in the room, you can kind of see where we may struggle with when it comes to labor. And so the posterior tilt, it shows that our pelvic floor is going to be tight. So that means if our pelvic floor is tight, we're probably going to have an issue with the outlet, because that means it's not going to be supple enough to allow this baby to smoothly come on out. And so we want to address that, which what does really well with doing that is going to be that sideline release. The standing psoas release as well will help with that too. And another thing that will kind of help is just breathing, for one, will really help with relaxing the muscles. Because if we think about it, if we're at a place where our pelvis is supposed to be aligned like this, and it has tilted this way, that is telling me that my muscles here are tight. And so this person might come in with shallow breathing. This might be the person that comes in that says, like, I can't just ever catch my breath. Help them breathe so they can expand that muscle. Big deep breaths throughout labor, fill those lungs up, so that way you can kind of help put that pelvis back into optimal position. This lateral pelvic tilt is the hip hike here. What we usually see that particular position is when someone has a child, they got a toddler and they're pregnant again, and they put that baby on that hip and they just kind of walk around with this baby. And that's those, whenever Tammy was talking about our lifestyle, it does really affect what's going on within our body. And so we want to bring balance back to that even before we start labor, because we're basically coming in at this way. And so what really helps with that is that glute scoot that I mentioned on that last slide there, and the standing psoas release helps with that as well. Doing that before we even start getting into labor, because we need to restore balance so this baby will have a optimal way of coming out. And so that's what that looks like. And it's not as exaggerated like that, but if we look at our patients while we're talking to them, we can kind of see these little things and kind of decide, like, okay, this patient might struggle with mid-pelvis because their body alignment is off. And then the last one is the anterior tuck. This is basically what we consider to be a neutral pregnancy position, what we expect for pregnant folks to look like when they're just kind of have given in to their baby and just letting it take over and creating a lot of misalignment. But what we see the most is an inlet delay for that, just because it's off. The baby's head won't be able to really just gather in and go straight down like it needs to. And so we just need to restore a balance within that as well. And the glute scoop can be helpful for that. But the main thing will be trying to help them to really bring that, not tuck it in on purpose, but just think about positions that really help with bringing us a little bit more into a posterior tilt. Next slide. And so when it comes down to preparing for birth, we just want to gather all of this. And when I say preparing for birth, I'm talking about in the labor room type preparing, because like I said, in pregnancy, before pregnancy is the best time to prepare. But if we've gotten in that labor room and we're seeing something that could show that there might be some sort of stall, even how their pregnancy went, some of the complaints and things that they had, or even if they've been that person that has been in the triage over and over and over again, they're contracting, but this baby is not coming down and they're still -3 station, and you notice that they have an anterior tilted pelvis, there's some balance that may be off there. And if we restore that balance, then we should be able to have a better chance at a vaginal delivery. And so let's create the balance. Those tools that I provided, I don't mind sending those out to you all the best way that I can, so that way we all can have it, but create the balance for things that we see. Really look at that body and try to figure out what's physiologically going on within the body that we can help with. Encourage the labor flow state. Let's have this room be very comfortable and relaxing and inviting for the patient. Address the stalls based on what's going on in their body. Is it a inlet stall, mid pelvis stall, outlet stall? Like, what's going on? Where is the baby? Not necessarily the dilation, but what's going on with the body? And always think about positions that allow for sacral mobility. Laying on our back does not help, but we can roll up some towels here, put them under here, and still give access to movement. Laying on the side is a great way to do that as well. So just staying off from laying here. And thank you so much. I hope that was helpful. If there's anything that I could explain better, it's a very deep concept and a lot of information, but I really do believe that when we have the background of what's going on, it can help our minds to process and know what we can do to help our patients. And so I'm grateful for this opportunity. I hope it was helpful. And if y'all have any questions or anything, I'm willing to take them.
Thanks, Amber. I loved your be a body detective. So that's kind of like, when we're at the bedside and we're kind of trying to figure things out, great information on that. And so as far as being a Body Ready Pro, how do you utilize that with your pregnant or your prenatal patients when they come to you? Just
so whenever
kind of
it depends on the complaint that they have. And if they're like complaining about the sciatica, I will give them tools that Body Ready Method has provided me with to be able to help with those tools, because we usually see the dysfunction with the balance by the complaints that patients have. That round ligament pain is not, even though we call it like, oh, you just got round ligament pain, that is actually a symptom of an unbalanced body. And so addressing what's causing those ligaments, which that forward inversion, leaning inversion will help with that, because that's what's needed, is to stretch those out. So by addressing the complaints that they have throughout their pregnancy, but I do most of mine outside of this realm for people that are actually looking for, because we do body ready assessment. So I'm able to do a full assessment of the body, which is outside of kind of what my scope is within my clinic. And to be able to give them tools that will help them out based off of what I assess and see.
Okay, good. So they kind of find you and then you do that assessment and work with them on addressing those imbalance issues that are identified.
Yes.
Great. Great. And well, thank you. Does anyone have questions for Amber about her presentation or Body Ready Pro that's on the call? If you do, just unmute yourself if you have questions. So I've seen lots of stuff in the chat about awesome and loving the information, and thanking you, Amber, for providing this.
Awesome.
So
thank you.
I don't see any.
I'm
Yeah, and we can get information out if we need to through our listserv. So anything that you might want to share with them after, just let us know.
Thank
Okay.
you.
All right. Thanks, Amber.